The International Society of Ocular Oncology, also known as the ISOO, is a nonprofit corporation with the primary purpose to advance and promote the practice of ocular oncology. It brings ocular oncologists from many different countries around the world together to collect, share, and question evidence and findings within the field of ocular oncology. As a sponsor of this year's ISOO, the Eye Cancer Foundation provided travel grants for various ECF fellows to attend. Let's meet these fellows and see what the ISOO and the foundation means to them.
I'm Dr. Chigozie Eche from Nigeria. I was privileged to be sponsored by the Eye Cancer Foundation to undertake a fellowship at the Shiva Medical Eye Center, Israel, an ocular oncology fellowship. Thanks to the Eye Cancer Foundation for this opportunity. Similarly, coincidentally, I was also opportune to attend ISOO Africa, the first International Society of Ocular Oncology conference held in Africa. Thanks to Eye Cancer Foundation for giving me the travel grant to support my presence at this conference. Thank you, Eye Cancer Foundation.
Hi, I'm Dr. Purnima Raspanikasnate, ocular oncologist and oculoplastic surgeon working at Tilganga Institute of Ophthalmology, Kathmandu, Nepal. I wanted to attend this ISO because I've been working as an ocular oncologist since the last 7 years, and I never had the opportunity to attend the oncology-specific conferences. I used to attend other general ophthalmology conferences like APKO or Asia Pacific Society of Oculoplastic Surgeons, and in those conferences I used to specifically look for the oncology sessions, and which were usually very less. So when I found out about the ISO, I was very excited and I wanted to attend this conference so that I can have a full day of the oncology sessions.
Hi, I'm Dr. Anna Musika from Uganda. I'm an ocular oncologist trained at Shiva Medical Center and facilitated or funded by the Eye Care Foundation. I was so excited to come to this ISOO Africa because I knew it was going to help me, first of all, to answer some of my puzzles, to hear experiences from other countries, like especially the ones in Africa, and also to get updated on what is being done as far as ocular oncology is concerned in the whole world. Because I expected to meet very many important experts from all over the world. And I'm so grateful that Eye Care Foundation made it happen for me.
I'm Dr. Abhilasha Maheshwari. I'm an ocular oncologist and ophthalmic plastic surgeon from India. I've done my fellowship with Dr. Paul Finger at the New York Eye Cancer Center. It's a collaborative event where people from all over the world come together for eye cancers. And I think it's a great opportunity to learn, take away this research and improve your patient outcomes.
Hello, good afternoon. My name is Dr. Yaqub Khzouz. I'm a histopathologist working in Jordan. I am an ophthalmic histopathologist with interest in retinoblastoma and uveal melanoma. I came here to attend ISO 2023 in Kenya, in Mombasa, Kenya. Since there is a specialized session about retinoblastoma and the histopathology of retinoblastoma. So during this meeting we reviewed all the histopathology criteria and diagnosis of retinoblastoma, the guidelines of enucleation and the guidelines of grossing enucleated eyes, in addition to revision of all the histopathologic changes in retinoblastoma, including the poor prognostic histopathological features. I had the opportunity to meet the best histopathologists of the world, from India, from Europe and from America, in addition to local histopathologists from Africa. So we shared experience, we shared our knowledge, and we shared our practice and discussed all the the issues in histopathology reporting, especially those with regarding the choroid invasion and the optic nerve invasion. And to reach a standardized reporting and to reach to answer all the questions of difficult cases where sometimes it's difficult to give a decision whether this is a poor prognosis or a good prognosis, especially in treated, pre-treated patients where you have a treatment effect in eyes in addition to residual viable tumor when you are not able to give an accurate grading or staging because of the small amount of the tumor.
Good morning, I am Dr. Yaqub Youssef. I'm the ocular oncologist at the King Hussein Cancer Center in Amman, Jordan. Today I am here in the ISOO 2023 in Kenya to collaborate with our friends and colleagues about management of eye tumors, specifically retinoblastoma. It is an excellent chance for us to discuss challenges and opportunities in the low-income countries about management of this life-threatening childhood cancer that affects the eye. And it was an excellent chance for us to introduce and launch the IRBCC, the International Retinoblastoma Comprehensive course. This course was prepared by more than 50 international experts in the field of retinoblastoma from 23 countries from 6 continents across the world. This is an online free educational material that can be used by ophthalmologists, ocular oncologists, ocular pathologists, even medical students who are interested to learn about retinoblastoma. This course will be used as guidelines for ophthalmologists worldwide to increase the education and awareness about retinoblastoma, and by that we may decrease the delay in management for retinoblastoma, and by that we can improve survival and save visions as much as possible.
I'm presenting on the lessons learned in advanced retinoblastoma by the AJCC Ophthalmic Oncology Task Force Registry. What it says is that in advanced retinoblastoma and the features of advanced retinoblastoma, it's better to enucleate the eye than to wait for salvaging the eye. That saves the lives of children all across the world.
So at this conference, I presented about the situation of retinoblastoma in Uganda. It is very important because we see very many patients in Uganda. Our expected number was 120, and the challenge as usual is that there is late representation, we have lots to follow up. And so it was important for me to share my experience and hear from others what they have managed to do about their situation, or if they are in the same boat with me, and I will get solutions to how I could overcome some of the challenges I'm facing in Uganda.
In this conference, I'm going to present on challenges in the management of OSS and ocular surface neoplasia in the low and middle income countries. So this topic is very suitable for me because I do face lots of challenges while managing OSSN and also while managing the retinoblastoma. So I'll be talking about the difficulties I face, hoping for some guidance and suggestions or collaborations from other institutions.
This conference has created a platform for me to present a topic titled The Histopathological Diagnosis of Conjunctival Tumors in my institution, University of Calabar Teaching Hospital, Nigeria. The topic emanated from the fact that conjunctival tumors are one of those prevalent tumors in sub-Saharan Africa, and most times we take them for granted because they span through the benign, pre-malignant, the malignant tumors, and it's been a diagnostic dilemma for most ophthalmologists because sometimes there's this slim line between differentiating benign and malignant tumors clinically, and therefore it's important to buttress the fact that every specimen removed from the eye should be sent for histological diagnosis to avoid misdiagnosis of pre-malignant tumors getting into the malignant stage and then creating unnecessary problems for the patient. Thank you to the Eye Cancer Foundation for also giving me the opportunity to present this at ISO Africa. Thank you, ICANSA Foundation.
Again, I would like to thank Eye Cancer Foundation and Professor Paul Finger for his contribution to our training and to our continuous education, and to give us the opportunity to attend such an important meeting in Africa. Thank you very much.
I'd also like to mention that I was in the last 2 days, I was very excited to meet the like-minded person, that means the people who are doing retinoblastomas. We work with passion, and we are driven by the retinoblastomas. So I was very happy to meet all the people from Africa and from other parts of the world. And for this, I'd like to thank Eye Cancer Foundation for giving me this opportunity and providing me with the travel grant to come here and experience this wonderful, wonderful meeting. And I wish to meet Dr. P.T. Finger in person someday in future. Thank you.
I thank the Eye Cancer Foundation for providing me with this opportunity to attend the International Society of Ocular Oncology Conference here in Africa. And I also thank Dr. Paul Finger for the endless opportunities that he keeps providing me in the form of research and mentorship. Thank you so much to the Eye Cancer Foundation and Dr. Paul Finger.
Thank you, Eye Cancer Foundation, for facilitating my travel, accommodation, and all the learning I have done here. Thank you very much, Paul Finger, for having a heart for Africa, and God bless you bountifully.
I would like to thank the Eye Cancer Foundation, chaired by Dr. Paul Finger, for supporting this meeting, supporting the IRBCC course, and for making us here together in Kenya. Thank you very much.